Salinas Valley Memorial Healthcare System's humanitarian volunteers, bringing medical equipment and expertise to the people of Irapuato, Mexico.
We picked actually Guanajuato area because so many people in this region are from there.
It was a project that brought a sense of peace and understanding between peoples, and it's one of those good-hearted, warm-hearted feelings that you get when you go and you know you've done something to lift them to a new level of health care.
A look at Salinas Valley Memorial's World Outreach next on Lifeline TV. Hello and welcome to Lifeline TV. I'm Dr. Bob Morali. The team of humanitarian volunteers here at Salinas Valley Memorial Healthcare System has traveled throughout the world to help hospitals that don't have the level of resources we have in our country. With our partners Assist International and Rotary International, our team takes donated medical equipment that has become outdated here and travels to countries all over the world, installing the equipment and providing training to areas that would otherwise go without. All of the volunteers from Salinas Valley Memorial Healthcare System use their vacation time for these missions, and they pay their own travel expenses. One of the most recent trips took our team to Irapuato, Mexico, in the state of Guanajuato. This is a major agricultural region similar to the Salinas Valley. In fact, many of the people who live and work in our area come from this region of Mexico. During the week-long mission, the team literally worked around the clock to install medical equipment in the hospital's intensive care unit. They also conducted educational sessions on healthcare administration. This is a trip that this team will never forget.
We heard they had a lot of medical needs, and so we said, well, let's go down there, and we sent a group down to figure out which hospital was the right hospital to go to that needed the equipment, that could really use it, that was a heart hospital. So Mike Hutchinson and some Rotarians went down.
And about 3 years ago, the governor from Guanajuato, Juan Carlos Romero Hicks, came to the hospital, and he asked the medical community for medical equipment to outfit a lot of their hospitals down there. And so we took that list, and between a number of doctors, Antonio Velasco being one of them, and then Natividad Medical Center and ourselves, we put together surplus equipment that the hospital wasn't using and was surplus, and we were able to make donations to the hospitals down there.
And we went down there on a pre-planning trip and visited 4 hospitals. Chose this hospital because of their abilities to handle the kind of equipment that we wanted to put in, and also by the fact that it is the hospital that all the people with heart disease are referred to in the state.
So they picked the right hospital, and we started trying to ship equipment down, which is very difficult going through customs. And we started raising money.
And we spent about 9 months getting a grant from Rotary. The Salinas, Maine and Castroville Club came up with $15,000. That was matched with the district, another $15,000. And so then Rotary International matched that with a $30,000 grant. So we actually had $60,000 to buy additional equipment, ship that equipment, and get it installed. None of those monies went to any of the team members. We all had to pay our own way, and our lodging and our food and our air transportation. So that all went for just the mission and the equipment.
And then Tyco and other big companies helped sponsor this with Bob Pageant's company, Assist International.
Coming to the hospital in Irapuato in Mexico, I think it's probably very typical that it's a family function. So people don't come by themselves, and here in the United States, of course, we have family members who come with us. In Mexico, the family is larger that comes, so instead of just maybe having 1 or 2 representatives, you may have 5 or 6 or 7 family members, or even double that with one person. So the lines are very long. It's very busy. There's constant, entry of patients, and their capacity is not such that they can take these patients. There's a long backlog of it.
And the lines would We literally extend down the street for 2 or 3 blocks, and these people came with food and blankets, and they came prepared to stay overnight. And we would ask some people on the street, you know, why are you doing this? Why are you bring blankets and food? And they said, this is the way it is. We expect to wait that long to get service. But it comes back to that there are a limited number of physicians, and if they can only see 10 to 12 patients a day, it extends the wait time beyond any range of what we would consider normal in this country.
A lot of people walk long distances to try to get healthcare services, and they're made to wait in lines. And some of them were in fact waiting in lines 24 hours before their appointment. So they're coming in from remote rural areas in that state and then, you know, going to the doctors.
Well, there were people in line outside of the hospital up to midnight waiting to be seen, laying on the sidewalk just waiting. All the lobbies were full. The ER, there were lines of people on gurneys, people that you saw in the morning still there at night, still waiting to be seen.
And people waiting and waiting for health care. It's amazing to see this, to witness, and you can see it in their faces. They need help.
A lot of the farm workers that we have and a lot of the families that have come from Mexico are from that particular area. A lot of the agricultural businesses that we have here in Salinas, Watsonville also have farms down and growing areas down in Guanajuato. Driscoll Strawberries, Semino Brothers, broccoli, Taylor Farms, almost all the major growers have dual type of relationships between Guanajuato and Salinas. So
we were there to basically do 2 things. One, probably most importantly, was install the cardiac monitoring equipment to a hospital that needed it and had some, but some of it wasn't working. The other role was to do an educational seminar, which we do when we do these trips, and so that was fun, and we got to do the educational seminar.
There are no wide-body jets that fly into the country. So you have 2 big ultrasounds that weigh 800 pounds, you know, in the packaging that was for them, and come to find out that no airplane could take it in. So we broke all the rules.
First we had to take the ultrasound machine completely apart, so we made 2 halves to be able to fit into the cargo hold. And that was about 3 hours per machine. And after we got that up to the airport, we found out it was still too big. So one of them came out of the crate, they wrapped it up with some blankets, put some saran wrap around it, and it's pretty dangerous because that's static.
One got there real well, one didn't get there very well. So in fact one, it was absolutely crunched. And it looked like it was going to be unusable. It was a echocardiography machine.
So I was nervous about that one, only to find out got more nervous when we saw it down there because it looked like it fell off the plane.
And we sat there looking at this piece of equipment after being in this hospital and seeing the great need, and you just wanted to cry because you knew it was needed, and what in the world can we do to fix this piece of equipment?
And then our job was to put it back together once we got there. And I thought that was impossible.
I called the company and they were, I asked them if it was possible to take all the guts out of the mainframe because I had to basically straighten it up. It was that twisted, it was kind of pretzeled up. And they asked where I was, and they were kind of surprised I was going to take the challenge on. Actually, it was kind of comical what their words were, but to make a long story short, we ended up just taking all the power supplies, all the 64 boards out of there, the backplane board that the boards plug into, out of the chassis. We took the mainframe out to a light post, we welded a bolt into a rod, and we stuck it inside the frame, and about 5 or 6 of us took turns as we hammered and straightened and pulled. We had the ultrasound's frame chained to a light post, and it was quite an operation, something you normally just don't do in the streets here in Salinas.
This particular project had a lot of barriers that occurred, and I'm not sure why. For a lot of reasons, some trips go very smoothly. You can plan the transport of the equipment, of the team. Everything just seems to fall into place. This particular project, things kept happening that were barriers. The dates kept changing, the transfer of the equipment seemed to be a challenge. It just was one challenge after another. And at the end, the equipment that we thought we had set up to come fully in place and intact ended coming with some damage. And it did seem for a short period of time that we weren't going to be able to surmount that. Here we had a damaged piece of equipment worth an incredibly large amount of money, and it was just not going to work. I was really pleased that our biomed person, Brad, did not give up, because it did not seem reparable to me. I was amazed. It was a miracle that in the end the equipment worked, but it took hours of working detail, minute, tedious labor to fix that piece of equipment. It still came out working really well. And that's the blessing of having team members that are real experts in this area. Some people would have said, no, we can't try it, it's not going to be worth it. In a third world country, you tinker with the equipment you have to make it work, because it's tough to get all the resources to fix it. So I think this was it was a very challenging trip, and it was a miracle that we were able to be as successful as we were, but it was actually one of the most successful trips we've been on. So I think it was meant to happen.
When the biomed group and all the people that helped out with fixing the machine and putting it back together, when they flipped the switch to see if it would turn on, that was a very emotional part of the trip also. It was, it turned on, and the cardiologist was happy, excited, and eager to learn, and eager to get his hands on the machine.
And I shudder to think if I'd had somebody besides Brad Carrot, who's the Director of Biomedical Engineering Services, here with us. But with him being here, I'm telling you, it turned out to be a great project. When it was done, you would have never known. In fact, the public, the mayor, everybody was there for the conclusion of this thing. And nobody knew the crisis problems that we had. And it turned out, I would say, perfect.
And then just watching the folks in the hospital and their interaction, you know, they're sort of surprised of seeing this new equipment arriving, and you know what to do with it and stuff. That was interesting. So I'm glad we were able to help them piece it all together, and we finally installed the equipment and got it going.
When we were able to install the equipment around all these people, and then come back and see that it actually all worked, and when we were able to work in an intensive care area, we had to make certain that we met all the infection control procedures we have here. We had vacuums right where they were drilling, and everybody wore all the gowns and masks. So it was very professionally installed, and it was a challenge, but we were able to accomplish it, and everything worked.
The people who work for the hospital are extremely capable and extremely personable. They're very well qualified, and they're very expert in their fields. People like Nancy, who knows ultrasound back and forth, people like Brad, who is incredibly capable of doing work with machines, people like Sam, who can see solutions out of problems, and of course the nursing department, who has incredible nurses to teach people how to get the job done. The hospital is surrounded by very, very capable people, and that's very, very satisfying when you do this kind of thing, because you know that you're not spinning your wheels. Even though you find impossible situations, there's always solutions, and that is very satisfying.
We worked some long hours, we worked some hard times. We worked probably one of the best teams I've ever seen, energy-wise, people pulled together. I've had some people that, like Paula Downing, who have been on the trips before, and she's probably one of the best biomeds I've ever worked with in my life. She's an honorary biomed, and I love working with her. Without her and a few of the other people, the trip wouldn't have been a success.
I think they were most appreciative of receiving that kind of equipment. It's something that they would not, as the cardiology guy said, we never would have dreamed of having this kind of stuff. He can now do echocardiography. The OB technicians can now measure babies in utero, do dating and sizing and that kind of stuff. They didn't have that.
So we went down there with the idea that we would have an educational program by nursing, by Irene Neumeister talking about nursing, that's in transition, by Pablo Romero and Max Cuevas about how they can treat patients, what's going on as far as telemedicine and what's taking place medically, and then how to be more efficient with their practices. And then we wanted Mike Perfuma, who's been a senior vice president with PricewaterhouseCoopers, and talk about the future of medicine.
And I had borrowed some information from PricewaterhouseCoopers that I had used elsewhere in these sessions in other parts of the world, was to give them a glimpse of what this study that PricewaterhouseCoopers had performed on what they thought the future of healthcare was. And I thought they were very interested in that.
The educational seminar we had in Aeropuerto was focused for the medical staff there and for the nursing staff. And this time it was very special because we had two physicians participate, Dr. Max Cuevas and then Dr. Pablo Romero. And they actually did a lot of the interpretation. We typically have an educational seminar and the interpreters are the people there from the hospital. This time our physicians not only presented their educational component, but they also interpreted ours, which was really, it brought another twist to it because then they would explain things a little bit more from the American perspective. So it was a great addition.
I have never been trained as a professional translator, so I was enlisted to do that. And that turned out to be a very satisfying but very tiring task. It's very hard to do, especially when you translate technical jargon such as nursing terms and ideas and accounting methods and all that. But luckily, Max Cuevas was there and we went back and forth. We would go for an hour, hour and a half, and then we became exhausted and the other one would take over, and that came in very handy.
I chose to speak on improving access to care, but I think they had asked me to speak on you know, the state of healthcare as it relates to community health centers and outpatient facilities like our clinics. And so I chose to talk on that and then try to extend it to their situation so they could get an idea, understand a model for, you know, providing access to ambulatory care services in a clinic setting. And I think it raised a number of eyebrows because you know, what turned out to be a 30-minute talk turned into a 2.5-hour session, and then even then we had to cut it because we had to go on to do other things. And so I think it raised a lot of questions in people's minds, and you know, officials from the hospital came over to ask questions, and then there were government officials that actually operate the hospital, and they were wanting to ask questions. And so they've sent a few emails, you know, on questions and stuff, so I sent them back information.
The session that the two physicians handled had to do more with some practical everyday matters. For example, they talked about the number of visits that a physician could handle in a day's time. And in fact, they even ended up having an argument with some physicians in the audience about how many patients could be seen by a single physician in a day. Statistics that were thrown out is that an average physician should be able to see, say, 30 to 40 patients a day, whereas their idea in Mexico was that they could see 10 to 12 was a full day. And the two physicians from Salinas went through a lot of detail about how do you get from 10 to 12 a day to 30 or 40 a day. And it has to do with organization and staff support and training. But basically a refinement of systems, which I like to think they listened to very carefully, and I think they got a lot out of those sessions.
So that's an example of what I think Max Cuevas and Pablo Romero felt, that they were interpreters. They had to, they volunteered their services to really work with the physicians that were there, the students, and I think they really enjoyed it. We really were appreciative that they went because they were very, very helpful in explaining the culture in the United States. And it went for probably an hour past the lecture, asking questions.
Sam Downing spoke in regards to administrative matters and sort of what's happening in contemporary hospitals and some of the the challenges of a hospital in the United States as well as what we see in Mexico. Mike Hutchinson spoke, and we also had Mike Profumo, one of our consultants, and then for my part of it, some of the nursing challenges. So,
what impressed me about the training was the extent of participation. Both days, for all sessions, the room was packed. They probably had, I would say, maybe 80 to 100 people in each session, and they stayed for the entire time. We had a lot of physicians in the meetings, a lot of nurses, staff from the hospital, but they really seemed interested in what we had to say.
And it was completely packed both days that we gave the presentations, and we did a comparison between healthcare in Mexico and in the United States, some of the technology advancements that we are making in the U.S., specifically our hospital, our cardiac program. The second day, I guess the word had spread that we had some pretty good presentations, and it was just literally packed the second day.
People were busy and they probably wouldn't be able to stay longer. Well, they did. They stayed through their lunch hour. They stayed after work to get this information, and it was about helping others. We had physicians and our president and CEO. There's Sam Downing, you know, helping unload boxes, and when he saw the need in that room of the lecture, he changed, and here he was like a servant, you know. He was delivering water and what could he do to help, and he was reading the room of what was needed and making those adjustments, and I thought that was a really interesting thing to observe, and thought there's another example of leadership and reading the room and being in tune of what people need. And I think that says a lot, too, about our organization.
The closing ceremony was very nice. We had a lot of the local mayor and a lot of the head of the whole health department for the region. They're very proud of what they have, and they should be. It's a tremendous medical facility, and I think that this monitoring will help them a little bit, but it was a really good hospital. So I know that they'll use it, they'll maintain it, and hopefully we'll be able to interact with them in the future.
They kept telling me that during the ceremony you would feel very emotional and very, you know, fulfilled with what you've done, and I did feel that, you know, especially going through pediatric ward. They didn't have the technology we had here, and I found that very emotional, seeing these little children needing equipment that we have here that we use every day, and they didn't have that. So it was emotional for me, that part.
And so this helped them because what they received was donated free of charge, and it was valued at over $500,000, everything that they received with it being installed. So they were happy about that. It also brought a feeling of peace and understanding between the peoples of that state and the strawberry capital here in the Salinas Valley. And of course, for Rotary, it was a blessing because it was a Rotary project, and that's partly what they do. If they hadn't provided some financing for this project, we could have never done the project. Salinas Valley Memorial Hospital is one of the best hospitals, I think, in Northern California. We've done over 10 projects with them around the world, in places like Tibet and China and Africa. And why look anywhere else when you have such outstanding people? You know, I would call them, with the work of Assist International, we've done over 60 medical projects in 39 countries around the world. They're the A-team. You have strong people that go and they get along well with each other. And you know, when you're going to a new culture, you're traveling a lot, you get very little sleep, you need to have people that are a real team. And the Salinas Valley Memorial Hospital is a real team. Never have ever questioned the teamship, and it's not about us, it's not about me, it's about we've got a high calling here, we need to get something done, we're going to work together to see it happen.
What stands out is how good people really can be and how true people can be. I mean, I saw something there and I felt something there that was genuine, and everybody should be proud of themselves that took a part on that mission.
Salinas Valley Memorial has been very successful and how we've been able to provide care here within our community. And we've been very blessed because we have a lot of support from a lot of resources and a lot of the people in our community. To be able to give some of that back to another country where that need exists, I think is part of that the whole expectation of a neighbor who cares. If you have it, the next step is what can you do to benefit others? And you benefit first your community, which we've done. We do a tremendous amount of community outreach here. But what we also are aware of is a lot of our patients we share between Salinas Valley and places like Yuma, Arizona, or like Aeropuerto in Mexico. There's a lot of common roots. And so to be able to take some of what we know and what we have back and share it, that is so important and so vital.
We call it humanitarian outreach program. It's really taking the resources that we have here in America and bringing them to other countries. And it's, in all cases that I've been involved, it's really stepped up the quality of care in that particular hospital, that particular area, that would have otherwise not happened.
It was a great trip. I think it solidified our outreach to Guanajuato. The governor was very, very appreciative. The Mexican consulate here in San Jose assisted with that. So I think it was a very good humanitarian project between both countries.
I'm very proud of our leaders that we have for this hospital. They strove to do what they were out there to do, and they made it happen.
All along I've been familiar with what Sam Downing and the rest of the crew here have been doing with going to missions all over the world. It just so happens that this particular location is very close to my mother's birthplace. And sometimes it's good to pay back when you're at the top of your game. If I wait until I'm 90 to pay back, I may not have anything to pay back. Whereas if I can pay back when I'm able to travel and to give and to teach and to teach others, I think then it's a little more valuable.
It's always nice to go to Mexico. I mean, it's a beautiful country, but I think when presented with the opportunity to go with the Salinas Memorial folks, I thought what a great way to hang out with a group of people that have been leaders in healthcare for quite a long time.
Our Lifeline publication, which comes out quarterly, we were able to put Max Cuevas and Pablo Romero, the two physicians, on the front cover. So it's kind of fun to make sure that their children would see them in a magazine that's circulated to probably 40,000 people in the region.
They said to us over and over again, this is fabulous, this is wonderful, this is like having a huge shot of inspiration, a huge shot of how we need to be to become more advanced in how we take care of patients. So I think it's very meaningful to them, and that's one of the things that keeps bringing you back to these trips.
And they come up and they say, oh, thank you so much, and you see it's from their heart, tears in their eyes, because they have a loved one that might benefit, or they're so gracious, very, very gracious people.
In the afternoon, we were able to see all the famous monuments, the church and all the related monuments. And Pablo Romero was able to explain a lot of the history in Max Cuevas. So it was a lot of fun to learn the culture and to be a little more educated to their traditions. And we had a great time.
Well, that wraps it up for this edition of Lifeline TV. Thanks for joining us. I'm Dr. Bob Morali. See you next time.